problem, because we narrowed the whole thing to just Korle Bu, but it's a national crisis, because it wasn't just Korle Bu that was, facing the problem. You go to Cape Coast, there's a problem. You go to Efia Kwanta and other dialysis centers across the country. We don't have enough machines. And those who even had the few, some have broken down, which need replacement. So it's really a problem.
Mr. Anka, at the end of the day, the reality is that you or we are even having this conversation and citing cities or big towns or even bigger facilities like the one that you work for, the Central Regional Hospital. And that is even where we have acute issues. It also means that outside the periphery of these major hospitals or towns or cities, the problem should be more acute. Is that not the case?
Yeah.
Why should we be worried about that?
Yes, because some of the challenges we face in those villages is that sometimes when people are in such conditions, they refer to rather go to the churches instead of the hospitals. And then the pastors will be telling them that I'll give you this concoction, I'll give you something to drink, and then you'll be healed. And so as a hospital, most of the time we try to do a lot of village outreach where we move to them and then we educate them, and if possible we do a free health screening for them. And so if you need to be consulted, the doctor will do the consultation. If you need to be referred to the hospital, that one is also done. For example, today we are having a float at Elmina, and that is purely for education. Tomorrow we are having a free health kidney screening for everybody who will come around the place. And so we try to reach out to them, even though it is not, let me say, 100% thing where you get to everybody.
Well, certainly. Now, Evans, because you are the renal unit as a nurse, it also means that you tend to see the cases, and even before we get to the acute stages, etc.
Yes.
What accounts for the rising cases of kidney disease as you see them?
Yes.
Not what we're told in the books, but face to face.
Okay. So what accounts for the cases? What causes the rise in the cases?
Certainly.
I would say in times past, we only see adults, the old age, who get the kidney failures, but of late, the young, even children are getting it. Unfortunately, some are born with conditions which lead them to...
Predisposed.
Yes.
Okay.
Some may be born with only one kidney, meanwhile they're supposed to have two. And then our lifestyle also.
The children's lifestyle.
No, I'm talking. We don't come to the hospital for cure when we feel sick. Normally, the signs and symptoms of this kidney failure looks like general malaria.
Yeah.
Yes.
A normal tropical disease.
Yes. So you sit in your house thinking, okay, you're feeling cold, you are vomiting, you go and take any other drug to take, and then you end up worsening the condition. You know, the condition, there are stages from stage 1 to stage 5. And then most of the time, until you get to stage 5, which is the final stage, which there is nothing we can do about it, you will never see the symptoms. So you may be at stage 1, stage 2, stage 3. You will still walk fine, do your normal activities. By the time you feel like you are sick, and then or by the time it knocks you down, and then you are brought to the hospital, you will be at the final stage. And then there's nothing we can do about it. So we should say, be aware of our health, and then seek for screening and things.
They tend to...
When?
Okay. But
that's good.
Okay. So, Thomas, critically, we are celebrating this or marking this because we want to improve the awareness level. How bad is the awareness level? And why should we take it seriously?
Well, I think that the awareness level, I would put it as maybe around 60–70%. Only that people are not paying attention to it. People think that it is something that is way, beyond or not closer to them. so they just live life anyway. How? Because I put myself in that, situation.
Okay.
I'm somebody, I don't smoke. I never smoked, or I don't smoke. I don't drink, but it still happened to me. So that tells you that everybody is at
prone.
risk, and you are prone to it.
So it's not about drinking and smoking
No,
and all
no.
that.
There are so many factors. There are times people have headache, then the slightest thing they are taking painkillers. All these things can even contribute to it. And again, in my condition, I developed hypertension earlier that I wasn't aware of. And when you have hypertension and you don't manage the situation, it can also land you in kidney problem. And that is one of the factors. So there are so many factors that can land you there. And then again, he mentioned hypertension and all of that, diabetes, all those factors can also end you up having kidney disease. So I think the awareness somehow, I wouldn't say it is bad. It is okay. Only that people tend to shoot it down.
Mr. Yankee, at the end of the day, we need big facilities like yours, Cape Coast Teaching Hospital, even the other maybe mid or smaller tier hospitals also to be having the dialysis machines.
Yeah.
Is it that they are expensive or they are just out of reach? How do we also get them?
You mean the machines?
Yes. Well, that's what you need for the treatment.
Yes. Yes, they are expensive, I know, but most of the time the major concern is the consumables. The consumables that they use in treating the patients. Okay. And then every machine has specific consumables to use. So, for example, Cape Coast Teaching Hospital, some of our machines are not completely out of use, except that we don't have the matching consumables to use. And so we need to pack them and then use the ones that we have. Okay.
How many do you have?
Currently we have 5.
5, but you need more, right? With the Cape Coast Teaching Hospital you're putting together.
Yes.
What is it about?
So this whole week has been commemorated for the World Kidney Day.
Okay.
And today, as we speak now, there's a float, as he mentioned, going on at Elmina, just to sensitize the public about the kidney problem. And then again, tomorrow, there's going to be free screening at the Kobnajan Square, also located in Elmina. Anybody who goes to Elmina should just go to the Chapel Square area. That is where Kobnajan Square is. That's where we are having a free screening. So you can just walk in and just be screened to be sure whether you have the kidney disease or not. So all of us need to be there, especially those who live around the area, just to be screened so that they can know their status.
So how do we get people to congregate and then also get to have the awareness level up?
Come again, please.
How do we need to increase the awareness levels beyond what we traditionally do?
Okay, so aside the education and all those things, I think some of the pastors, as my boss said earlier, should also be educated, or should say be warned, because
Pastors?
Yes, the pastors and the herbalists and things, because one thing that also increases the condition or brings about the condition is these herbal drugs. They are toxins to the kidney. The kidney is supposed to filter the blood and then sieve out all toxins in the system.
All herbal drugs?
So the reason why we're saying herbal drugs is that when we compare to the orthodox drugs, the orthodox drugs, they are sieved, and then depending on the particular ailment they want to treat, that is what they actually manufacture. But the herbal drugs is just combination of herbs, so it could say have plenty functions. So let's say you are treating your stomach pain or your headache, but you may end up hurting your kidneys. When a person is admitted at the hospital and then he or she is being treated on a condition which also affects the kidney, or which the drugs affect the kidney, normally they are placed on test to monitor the progress of the drug and then the kidney. So when they realize that, okay, we are doing damage to the kidney, they stop the drug. But with these herbal drugs, We are just taking in as much as we want. You may be advised to take a cup or a two cups.
The dosages are not
yes,
well.
the dosages
All
are
right.
not well.
And so we'll make sure also we continue with the awareness creation. And is there any event you'll be doing tomorrow, Mr. Yanka?
Yes, that's what I said, that we'll be doing a free screening. And so we are inviting everybody in and around Elmina to get to Combinajan Square to do the screening. We are also inviting everybody, especially in the month of March. Make sure you visit a hospital and then check your kidney. Walk in and check.
Thank you very much. We've had here Thomas Khan, and Thomas always on hand for us, and then Frederick Yanka as well, representing the Cape Coast Teaching Hospital as a PRO, and then of course Evans. Evans Akwabwa is a nurse with the dialysis unit of the Cape Coast Teaching Hospital. Thank you very much. You haven't traveled yet. When are you going to UK, America? Have you written the exams?
We won't allow him to go.
Well, but Roland, I don't know. Before we go, we will make a passionate appeal to government and policymakers. There was a promise by the health insurance to make sure it covers the dialysis. So we are still making an appeal to government that please, and again, Mr. Okoboy, you were at the NHIS. Now you've been moved to become the health minister. We are pleading with you that make sure that that promise. You told us that by the quarter of this year, we are in March. So we are pleading that...
He told you that?
No, there were announcements like that. And we are praying that we have the NHIS doing something about the dialysis, because we are losing a lot of lives. Roland, there are people dying faster than the disease because of the cost of dialysis. So it is a serious issue that we need all of you to come on board and for us to tell government what to do. So please.
Well, certainly. Yeah. So we have the day itself being marked tomorrow. That's the 14th of March. But I think the Cape Coast Teaching Hospital, the dialysis unit doing this is massive. A good initiative. Worldwide, we're told, according to the last statistics that was picked by the World Health Organization, by way of their estimation, we have some 850 million people worldwide. And then also some 3.1 million deaths. We're told that averagely we have 10% of the population having either disease stage or some level of ailment. Well, we need to keep the conversation ongoing. You get an upload of this. TV3 Ghana is available for you. But also what we'll be streaming there live is a conversation that Bella Mundi will be having with human rights lawyer as well as Member of Parliament for Medina, Francis Xavier Sosu, up next. Stay with us.